And we're off. Here we go. Let's take it away. Good morning, everybody. And we're awfully glad to have you with us. Hi, and welcome to Social Security and Supplemental Security Income During the Pandemic, presented by Bethany Lilly, Director of Income Policy at the ARC of the United States, and hosted by us here at the ARC Oregon. Thank you for joining us today for this live broadcast on Tuesday, May 5th, 2020. Today's session is being recorded and will be posted later this week at thearcoregon.org. My name is Alan Lytle, and I serve as the Operations Support Director for the ARC Oregon. I'll be your behind-the-scenes host for today's broadcast, along with Susan Stonecipher-Hawkins, one of our fantastic administrative assistants. Now, the ARC Oregon has been serving Oregonians with intellectual and developmental disabilities and their families since 1954. We, together with our network of members and affiliated chapters, advocate for the rights and full community participation of all children and adults with intellectual and developmental disabilities. Our programs include Oregon Special Needs Trust, our Guardianship Advocacy and Planning Services, or GAPS program, as well as our newest program, Oregon Training and Consultation, or OTAC, which joined the ARC Oregon in 2018. You can learn more about all of our services and join our new online community by visiting thearcoregon.org. Now, before we begin, take a moment to locate the GoToWebinar control panel. There you can find a copy of the slideshow for today's webinar that you can download and reference later. You'll also find a questions for staff box. Now, if you're watching today's webinar live, feel free to submit questions there. If you're watching a recording, we invite you to email your questions to info@thearcoregon.org or reach out to the presenter using the contact information she provides. Now I'm happy to turn this webinar over to Bethany so she can get things going. Welcome, Bethany, and thank you for joining us here at the ARC Oregon today.
I'm so happy to join all of you, and I think we chose a fairly important topic today, so I'm glad that folks are taking the time to participate and learn more about Social Security and SSI. And I've framed this kind of as three major topics. We're going to talk a little bit about kind of SSI and Social Security basics because I always can use a refresher, and I figure most people can too. And then we're going to talk about kind of Social Security policy issues and big picture changes that the ARC nationally would like to see to the programs. And then we're going to talk about COVID and how that's impacted things and discuss how exactly Social Security and SSI are dealing with not only kind of administratively what the Social Security Administration is doing, but also what Congress and the legislature is doing. So we're going to start off with Social Security and SSI basics. So when people talk about Social Security, and I do this a lot myself, so I will just be very upfront about that. I am sometimes talking about two different programs. I am sometimes talking about both Social Security and SSI, or Supplemental Security Income. I think it's actually probably more widely known as SSI than it is Social Security or than it is Supplemental Security Income, but both of these programs are incredibly important, and they provide income support and cash assistance to people with disabilities. This is a monthly payment usually, and it depends, your payment amount depends a lot on what you're getting. SSI has very strict means testing, so that means that it is a program predominantly for people who are low income. And Social Security benefits can come in a couple of different forms. You may have worked enough that you are entitled to Social Security disability insurance. You may also be old enough and have enough work history that you're claiming old age insurance, which is not a very nice thing to call it. I know now that's not exactly what we'd name it, but that is what historically we have called it. And there's also survivor's insurance. If something happens to the primary worker in your family and they can't help take care of you, then Social Security survivor's insurance will kick in. Unfortunately, I think we're going to see a fair amount of that over the next couple of months with Social Security stepping up to help families following the COVID pandemic. And then there are also a couple of other forms of benefits that folks with disabilities, very specifically, and a lot of folks with intellectual and developmental disabilities receive. And these are things along the lines of disabled child benefits. They could be called other types of benefits, but effectively, they're benefits that children with disabilities, no matter what age they are. So you can be 46 and you can be receiving children's Social Security benefits on your parents' record. And so these are kind of the different ways you can become eligible. And why are SSI and Social Security so important beyond just providing cash assistance? And I think that probably if you ask most folks, they'd say, well, Medicaid or Medicare. And that's because depending on the type of benefits you have, you are eligible for different types of health insurance. And that makes things a lot easier. In fact, many people who are on SSI rely very heavily on Medicaid, on HCBS services, and SSI is their eligibility pathway. So I have a question for folks who are on this presentation, and I think Alan is going to queue it up. And the question is, do you know if you, your family member, or the people you serve are on Social Security or SSI or both?
Great. So we've posed this question here. It'll pop up in your webinar panel. Go ahead and respond. Do you know if you, your family member, or the people you serve are on Social Security or SSI or both? Well, Bethany, it looks like folks are responding quickly, and overwhelming majority of folks say that yes, their family member or themselves or someone they serve are on Social Security, SSI, or both.
Excellent. So I guess you guys all probably know exactly how important these services are, and you may know a little bit about how the process works. And part of the reason I'm asking this question is to get a sense for how closely you might be aware of the process. So I don't think I'll spend a lot of time on this, since I think you guys probably have spent a lot of time on this already. But to access SSI or Social Security, you have to go through the disability determination process. And that means that the Social Security Administration will review medical records, they'll review information about your assets and your work record and a whole collection of other things. And even after they've done that the first time, they will keep coming back and verify that you are still disabled. And that can be as simple as a letter that they send you and you fill it out, or it can be as complicated as them asking you to see a doctor. And so making sure that this disability determination process is functional and works well for people with disabilities is an incredibly important policy issue for the ARC National. And it's been something I've spent a lot of time on since joining the ARC about a year ago. I will say the continuing disability reviews process, that's been something that you may have seen some action on much earlier this year before COVID. And that's something that I've been keeping a very close eye on. So before I get into kind of what's going on with the pandemic, well, before we go there, I have one other question. Alan, could you key up the CDR question?
Yes, I sure can. Our next question asks, have you, your family member, or the people you serve been through a continuing disability review? Go ahead and mark yes, no, or I'm not sure. Have you, your family member, or the people you serve been through a continuing disability review?
We're getting a lot of yes, and it looks like we're getting a lot of I'm not sure, which is completely fair.
That's right. It looks like 2/3 of folks present in the webinar say yes, and 1/3 say I'm not sure.
Well, and that's because it can really vary what this type of review looks like. As I said, it can be as simple as they just send you a letter and ask you to check a couple boxes and sign a form, or it can be more complicated and they want lots and lots of medical records, and they may even want you to go see their own doctor. And so it's a complicated process. I think it's a really scary moment for a lot of people with disabilities and their family members and service providers, because we all know how important SSI and Social Security are. And so going through this process again just makes people feel very vulnerable. And I think it's a very hard process and it should be as easy as possible. And so while I'm not surprised to see those answers, I'm a little disappointed that Social Security hasn't made it more clear to people what exactly is going on. So thank you for helping me understand better how this is kind of working on the ground. So looking beyond the pandemic, there are also a collection of other Social Security and SSI policy issues that I focus on. I'm guessing that most people are pretty familiar with these issues, but I'll run through them. I'm guessing most people have heard of the SGA limit, or the substantial gainful activity limit. And this is an amount of money that people on Social Security or SSI can earn without jeopardizing their benefits. This number increases every year, and in 2020, it will be the numbers that I have on the screen. And there is a higher income limit for individuals who have a vision-related or vision impairments. It is, however, just in the statute referred to as the SGA for the blind. And so we tend to refer to it as the SGA blind level. I often, when I do webinars like this, get the question, why is the level for people who have vision impairments different? I don't know. I've asked people who are in fact older than I am and have been doing policy for a lot longer than I have, and none of them seem to know either. My guess would be that a particular member of Congress, either a senator or representative, had some very strong feelings about how this should change. But if anyone has a better story than that, I would love to hear it. So there are also our asset limits, and this is a problem for SSI and not so much of a problem for Social Security. And that is how much money people on SSI can save and how many assets they can own. So assets could include things like cars or houses or things related to that. And right now, SSI has a $2,000 asset limit and a $3,000 asset limit for couples. So if two people on SSI get married, their asset limit decreases. This is something that we call a marriage penalty, and there are actually quite a few of them in Social Security and in SSI, but this is the asset limit penalty, so to speak. I will say, I said that this isn't so much of an issue for people who are on Social Security, and that is generally true. People who receive Social Security benefits don't have to worry about asset limits, but they may rely on other programs where asset limits are different or important. If you receive supplemental nutrition assistance, so if you're receiving SNAP benefits, there are asset limits in SNAP. And for a lot of other programs that are kind of assistance programs like that, there are asset limits. So it may still be a problem for folks who are receiving Social Security benefits, and it may be a problem for people who rely on SSI to access Medicaid. Medicaid, just to flag for you, also has asset limits. So this is something that I spend a lot of my time digging in on, is asset limits and how can we make them work better for people with disabilities. My answer to that question is raise them substantially. And we'll get into that a little bit later. So I talked about the asset limit penalty, but there are other marriage penalties. And I think this is something that really hits home for a lot of people with disabilities, and I think is incredibly frustrating. And so I just want to highlight this because I get a lot of questions about this policy area. So generally speaking, marriage is, aside from the asset limit penalty, not going to be a big problem if you get married to someone who has the same benefits you do. So if you get married to someone else who is on SSI and you yourself are on SSI, that should be fine. That does mean that you're going to have a lower asset limit, and it does mean that your benefits will be reduced somewhat, but you aren't going to lose your benefits. Now, if you're on SSI and you marry someone who isn't, in all likelihood, you will go over income and you will lose your SSI. There are also challenges for people with certain kinds of Social Security benefits. This is a particular problem for people who fall into the disabled adult child benefit category, because those folks, if they get married, they can't keep getting their benefits. Their benefits are just completely cut off. The one exception is if they marry another disabled adult child beneficiary. And this all sounds like a lot of gobbledygook, and I don't disagree with that definition, because I do generally think, and the ARC nationally thinks, that you should be able to marry who you want to marry. But unfortunately, these rules are very complicated, and it just is very, very complex for people. So this is another issue I spent a fair amount of time working on, and I know that there's a lot of interest in certain offices in Congress of doing something. So we're hopeful that we'll see some type of legislation. I was originally supposed to give this presentation at the ARC of Oregon's convention, and I was really excited because I actually thought I might have a bill on the marriage penalties to tell everyone about. But unfortunately, that was when COVID happened. And so things have been thrown off a little bit since then. And I just, this is something that a lot of folks have been doing here in DC, and I find it really kind of a good opportunity. I hope all of you are holding up okay. And I would love it if you could just tell me a little bit about how you and your family are dealing with COVID, because it matters to me how you guys are doing, and I'd love to hear that. So Ellen, if you could key that up as a question, or however we're doing this one.
Sure thing. We'll invite folks to go to your webinar control panel if you'd like to share comments about how you're doing with COVID-19. Type your brief response right into the questions for staff. I'd love to hear from you.
And I see that we've already gotten a question around the asset limits being temporarily waived. That's an excellent question, and it's one I get a lot. Unfortunately, I have brought it up with Congress, and they do not seem particularly interested in dealing with this issue. I would highly recommend, if that's a problem for you, reaching out to your member of Congress and asking them to do something about the asset limits right now. I think a temporary waiver would be a great idea. In fact, I will say Senator Wyden agrees with me on this and has been very active. And so we've had a lot of very good people on this, but unfortunately, there are certain members of Congress who don't think this is a good idea. And I'll actually get into some things in a little bit about kind of some other problems we're having because people don't want to address Social Security issues in a way that makes a lot of sense. Yeah, I'm sure there have been lots of financial issues.
Bethany, one attendee responded that that they're working from home and indicates that it's been frustrating that many folks we serve have been laid off indefinitely until the state opens up more, and we're dealing with a lot of financial issues.
I'm sure, because folks rely on the money they make, even if it's only a part-time job, so they can keep their SSI and SSDI benefits. It's really important financially. And one of the things, lots of hand washing and sanitizing. Same. Lots of that on my end.
Jennifer says she's gardening and even ordered some rare seeds.
Oh, I like that. That would be, I actually have a couple new plants sitting right next to me, which I don't know if I can technically pick up my laptop right now. I don't want to mess anything up, but.
We just put in our tomato plants over the weekend. Someone else says we're all introverts, so we're holding up all right.
Oh, I'm so glad to hear. Yeah, I've actually been enjoying doing all of this, so. Bored but healthy. That seems like a very accurate assessment of, I have not been bored. That's actually been my major problem. I'd like a chance to get bored. That would be nice. So I think we've gotten kind of a good sense of how folks are doing, and I think that there are a couple things I'm going to talk about in terms of COVID that may be useful in terms of questions about jobs and about other benefits for folks who have lost jobs lately. So let's start off with kind of baseline. Benefits are still being paid as usual. There has actually been a little bit of a scam issue around people getting scam calls asking them to re-verify so their benefits can continue. And that is a scam call, and you should ignore those calls. Benefits will continue to be paid as usual. The thing that really has changed is that the Social Security Administration, like all of us, has gone to telework. And so that means that the way the disability determination process and the review processes are working is a little bit different. A lot of the Social Security and SSI processes, including continuing disability reviews and overpayments, have more or less been paused. So for what it's worth, if you were in the middle of a CDR or you're dealing with an overpayment, most of that process should have paused because they understand that this is a really stressful time for people and they don't have quite all the resources to continue to process things in the same way electronically. So I'll also point out, if you go to www.ssa.gov and go to their coronavirus website, you may be able to find an answer to your question. They're keeping it pretty well updated. If you think there's something on there that they aren't answering, please feel free to send it to me and I will see if I can get them to answer your question, because they've actually been very good about trying to update that with questions that people may have. But I just want to say, right now, what benefits are going to continue to go out as usual, and just some other parts of the system have been paused. So what has Congress done? This is a big question. There have actually been 4 different pieces of COVID-related legislation passed. The very first one was a lot of research money for NIH. So we aren't going to talk about that because it was just effectively a lot of research money. But the next 2 pieces of legislation were very big. And the first one was called the Families First Coronavirus Response Act. Here in DC, we call it COVID-2 because it's just easier to refer to the bills in order. But the piece that Families First Coronavirus Response had was, it included an expansion and emergency structure of paid sick days and paid FMLA leave. And I'll get into that a little bit more shortly, but those were kind of the big provisions there. Other provisions that you may have heard about, and I don't handle those, so I can't answer your questions, I'm afraid, but were provisions around Medicaid, provisions around, which I will get into a little bit later on, but there were also provisions related to other services and help for people. But primarily the part that I focused on in this legislation were the emergency paid sick days and the paid FMLA leave. And those are supposed to help people who need to take time off because either they have coronavirus or they're taking care of someone who has coronavirus, or, and this is the part that I've been paying a lot of attention to, they have a family member who's lost their usual source of care. This third piece of coronavirus legislation, the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act, was much, much bigger. It was a very expensive bill, and that included the Paycheck Protection Act that you may have been seeing a lot of news about as it ran out of money and then Congress gave it more money. And it is designed to help small businesses, although it's maybe not working quite exactly how Congress intended. And I have a colleague who specializes in that, so if you do have questions about that, I can connect you to her. But the parts of this act that I was focused on are the economic impact payments, and those are the cash payments that Congress passed to go out to most Americans, and then the unemployment insurance provisions. And there were actually 3 of them, and I've only listed 2 here because the third one was basically an extension of traditional state unemployment insurance. And as some of you may know, that doesn't necessarily work all that well for people with disabilities. And so we try and make sure, so the other 2 programs, the PUA program, the Pandemic Unemployment Assistance Program, is a little bit better for people with disabilities. And so we'll talk about that. So the emergency paid sick days and leave. So the Families First Act requires 2 weeks of paid sick days and 12 weeks of paid leave for some workers. And it also included refundable tax credits to help employers pay for the cost of this leave. Employers pointed out very quickly that the refundable tax credits weren't going to come out as quickly as they would have liked. And so they actually changed this in the CARES Act and made the tax credits move more quickly for employers. And something to keep in mind is you can access these benefits if you are on Social Security or SSI. It depends entirely on what the other rules are. So just because you have Social Security or SSI does not mean you aren't eligible for paid leave or for paid sick days. But unfortunately, there are a lot of other rules about these benefits. So if you are an employee who works for an employer with more than 500 employees, then you won't be eligible. And many healthcare workers and other essential personnel are exempt. It does depend a little bit at that point on some other factors, but those are kind of the big picture like things that aren't included. And the other piece is that people can only take sick days or paid leave for certain reasons. So the sick days provisions are actually pretty broad. So if you have a person with a disability that you're living with and you're their roommate and they need your help because they either need to self-isolate or they need help because they have coronavirus, you can use the paid sick days to help take care of them. Likewise, if you're a sibling or a grandparent of someone with a disability, you can take off the paid sick days. But the paid leave provisions, which are the longer 12-week provisions, which I think are getting a lot more important as we are under stay-at-home orders for much longer, those are only applicable to people who are parents and only applicable if the usual place of care has closed. So for a lot of parents, this is schools. This is very much how Congress was trying to help parents whose kids are no longer in school or no longer in childcare. But luckily, the Department of Labor, and I don't know if any of you submitted comments when the Department of Labor was having a listening session on this, but we at the National ARC did, and a whole bunch of our allies in the disability community did. And we asked them to expand this to make sure that all family members could take paid sick day, could take paid leave to make sure that their people with disabilities are taken care of. Unfortunately, they didn't go as far as we had asked them to. They didn't include siblings and grandparents and other family members, but they did include parents. And so that means that parents who have children with disabilities who have lost their usual source of care should have access to the 12 weeks of paid leave. As I said, there are other rules. So if your employer is particularly big or if you work in certain industries, it won't apply. But hopefully this will help some people who may have had a loved one's day program close or may have had an employment service that loved one receives not available anymore. And so hopefully this will be helping some folks. We'd love to see this expanded to siblings and grandparents because we know that that's a circumstance that a lot of families find themselves in, where someone who's not the parent may need to step up, maybe because the parent has COVID. That's actually happened with some folks. And so we'd be very, so that's one of the things that we're hoping we'll see in the next piece of legislation, that we'll see a proposal that would actually include the broader definition of family. So it's not just the parents, but other folks who can also access this to help their loved ones. So the economic impact payments, and I have gotten more questions about this than I have gotten questions about anything ever in my entire policy career. So Congress authorized direct payments to most people in the United States. The payments were $1,200 for individuals and $2,400 for married couples. Some dependent children, those who are under the or at the age of 16, can receive $500 credits. This actually excludes a lot of people with disabilities because a lot of people with disabilities actually rely on their parents, and so they're dependents of their parents. And since they're over the age of 16, they won't count. They won't receive their $500 credit. This is also a big issue for college students because they likewise are probably claimed as dependents. And it's an issue for older adults whose families are taking care of them and claim them as a dependent. And so there are a couple different populations this just excludes. And we were very strongly advocating that they include a much broader definition of dependence. And now we've got a couple bills in Congress that I'll talk about later, but hopefully we can see some changes there. And this has been, it's been a long process. And you may have gotten a couple different updates about this because when it started off, people who receive Social Security and SSI were not supposed to get these payments automatically. But obviously that's just too complicated. People who receive Social Security and SSI and who don't have to file taxes shouldn't have to file taxes to access this payment. And so we advocated very strongly with the Social Security Administration and with the IRS, and the IRS is kind of in charge of how these payments are made. And we also advocated very strongly with Congress, and Congress started calling both the IRS and the Social Security Administration, and we have managed to work out a solution. So if you are on Social Security or on SSI, you should get your economic payment, if you are eligible for it, directly the same way you get your Social Security benefits. So it should go directly on your Direct Express card or go to your usual bank account, and it should be very, very straightforward. Now there is a quirk or a couple of different tricks there, or things that aren't settled yet, because this has been a long process with the IRS. One, I still don't quite know how they're going to help kids who receive SSI. So if you have someone under the age of 18 who receives SSI, I'm not sure how they're going to treat those people. That's a couple million kids, and we'd like to make sure that they get their $500 dependent credit. And I'm not quite sure how that's going to work. So I can't give you an answer right now, I'm afraid. I'm still working with the IRS and the Social Security Administration to figure out what that looks like. And the other one is, if you have a dependent child and you are on SSI, you need to fill out a form to get the $500 credit for the child. And I included a link to the form in case anyone needs it right now. And I partially did that because the deadline is today. It is May 5th, and if folks don't file that form by the end of the day today, they are not going to be able to get their credit for their dependent children until 2021. And you'll have to file your taxes in 2021 to claim the credit. If you're on Social Security as opposed to SSI, I'm afraid the deadline has already passed. It was a 48-hour deadline, which we thought was completely ridiculous, but that is the deadline that the IRS announced. And so I'm afraid if you have dependent children and you receive Social Security, you can only get the credit when you file taxes in 2021. And now the most important part of all, because I know this is immediately where everyone's minds go. These economic impact payments are not counted as income. So they don't apply to SGA. You don't have to worry about it messing up your SSDI. You don't have to worry that this is something that is going to complicate the circumstance. However, and for assets, they're not counted as assets for the first 12 months. So you have 12 months to figure out how to spend the money before it counts as an asset. So this should be great. Provided that folks are getting their payments. I don't know if folks have started getting their payments. And so I have another question for folks if Alan wants to pose the question. But basically it's just, how is the economic impact payment going to help you? And if you want to add that answer to your question, to the question box, that would work. I think we can read it.
Exactly. If you want to restate your question, restate the question, and then folks type responses, if you wish, into the questions box in the webinar control panel.
How is the your economic impact payment going to help you, or what are you going to spend it on? Maybe that's a better way to put the question. Yeah, people on SSDI should automatically receive the payment. The question is, It depends a little bit on when and how you get your payment. So my understanding is by the end of this week, if you get direct deposit payments, it should go out. And if you don't get direct deposit payments and you get it on your Direct Express, maybe also this week, but I don't know. And then if you get a paper check, usually it will be a while because they have to kind of print the paper checks and they have an order in which they're doing them.
It looks like we've been getting some responses to the question. One indicates we'll be placing our daughter's payment into her Able account. Able is one
Oh,
of those
great.
financial management tools.
Able accounts
And
are great. That's a good way to handle it, just in case something happens and you don't want to spend it until after 12 months. I will say if you put it in the Able account, then the asset limits don't apply. So,
someone else mentions that we'll spend it on clothes and makeup.
oh, that's a good way to do it. I like that.
Another response, creature comforts, new towels, new comforter. If I'm stuck here, I'm going to be comfortable, says Jennifer.
I like it.
Someone else says that they gave it to charity.
Oh, it feels good to be able to help other people right now.
Diana says, I received mine and bought new tires for the car.
That's a good use. I used mine to pay down some student loan debt, so also a good way to kind of do that. Well,
Someone else says they're sustaining their family until work is restored.
yeah. And that's honestly, I think how a lot of people and a lot of families are going to use these payments, which leads directly into our next issue, which is unemployment insurance, because I think people have a lot of questions about support that they can get if they've lost their jobs. And unemployment insurance is generally available. The rules vary from state to state, so I cannot tell you anything specifically about Oregon, I'm afraid. And I'll just say that it's one of those things that, like Medicaid, it really varies from state to state. But I will say that a lot of people with disabilities aren't always eligible for state unemployment insurance because there are certain rules about work search and about being ready and available to work full time that sometimes apply. I don't know if that's the case in Oregon, but I will say that it can be challenging for people with disabilities to be eligible depending on what the state rules are. What's changed is that Congress passed a new emergency UI program called the Pandemic Unemployment Assistance Program. And this is designed to help a lot of gig workers and part-time workers who may have lost their jobs. And so because of that, it will also help a lot of people with disabilities who also work part-time. So you may be eligible, and it's definitely worth checking with the state agency. I will say most state unemployment agencies are really overwhelmed right now. They have a lot of challenges in terms of just responding to phone calls. And so I'll just warn that there may be a bit of a wait, but I definitely think that if you usually are working, it's worth checking in because Congress really has expanded the criteria for who is eligible for unemployment insurance. They have also really dramatically boosted the amount of unemployment insurance people can receive. They have added a $600 a week boost to both the emergency UI and the traditional state UI programs. Usually UI isn't quite full wage replacement. It just won't get there. It's not enough money to cover all of everyone's usual expenses based on their old salary. Sometimes it does. It depends, again, a little bit on which state you live in. But this new bonus that Congress approved will help people actually fully replace the wages if they've lost their job. So helping them pay for their rent or their mortgage or their food or all of the different pieces there. So I'll just say that if you receive SSI and Social Security, you may be eligible. There are a lot of misconceptions about people on Social Security or SSI receiving unemployment, I have actually had state agency officials tell me that people are not eligible because they receive Social Security. That is not true. You can still be eligible for your unemployment insurance. So you may need to advocate for yourself if there's some confusion about how this all works. But I will say that the law says that that is not at all the case. And how do I know that? Well, the Social Security Administration actually has a lot of guidance on how unemployment benefits are considered when it comes to the broader kind of asset limits and rules of Social Security. And so UI is counted as unearned income. And this means that basically for people who receive traditional Social Security benefits or on DI or a DAC beneficiary or who get Social Security benefits, they don't have to worry about it. It's unearned income, it's disregarded, it doesn't count towards SGA. So if you're on a Social Security benefit, a Title II benefit, you're fine. You don't have to worry too much about this. It may have an impact when the money starts coming in on your SNAP benefits or on other means tested benefits that you receive. So I would just caution that it's worth kind of checking on those benefits before, just so you understand what the implications are. And that's where it gets more complicated for people who are on SSI, because SSI can be offset by other benefits you get. And some of you may have experienced the SSI work taper, where you lose 50 cents of every dollar for every dollar that you earn. And that's great, but that's because it's earned income, which means when unearned income comes in, it gets more complicated. It may completely offset your SSI benefits, especially since Congress added that boost and gave people additional money. That's mostly okay, because the money that will be coming in from UI will kind of replace the cash supports. And your SSI will be placed in suspension, which means as soon as the UI benefits go away, your SSI should restart. Now, I'm guessing there are a couple people who are listening to this and thinking, but Medicaid, and that is exactly right. I completely understand that concern. Luckily, in the second piece of coronavirus legislation, Congress included a provision that says nobody loses Medicaid until the end of the emergency. And so it is actually right now practically impossible for states to kick people off of Medicaid. So no one's losing Medicaid right now. In addition, in Oregon, it's very likely that you would be eligible for Medicaid via other pathways, like the Medicaid expansion pathway. And so there shouldn't really be any implications for Medicaid, but just so you understand, it is a little bit complicated. And there are some, I can completely understand people being worried, but it should be totally okay. And if you have questions, or if you're talking to someone and you want them to have a better understanding, we have prepared a fact sheet on this issue. And please feel free to share it widely. Please feel free to bring it with you if it would help, if you're going in to meet with the unemployment office or other folks. Well, you wouldn't be, I guess, if you're calling the unemployment office or emailing them. And so hopefully these benefits should help people get through this time where they don't have employment. And hopefully we shouldn't run into any issues, because legally there shouldn't be any issues with Medicaid or with other things. Again, I just want to flag how this works with SNAP depends a little bit on the state you live in. But again, it shouldn't really be much of a problem for SNAP. It just may offset or reduce your benefits a little bit, but hopefully if it's doing that, then the benefits you're getting from UI are expansive enough that it should work. So that is unemployment insurance. It is very complicated, and I imagine folks may have some questions about it, so I will make sure that I'm leaving some time at the end for questions. So Medicaid, I've mentioned that people can't get kicked off Medicaid, and I may have mentioned earlier that Congress did include some funding boosts for Medicaid, but Congress hasn't done anything to help support direct service professionals getting PPE. They haven't done anything to help HCBS providers or home and community-based service providers get what they need right now and make sure that they have the resources they need. And so that's one of our big priorities. And we are asking Congress for kind of 4 big things. You can contact your members of Congress if you'd like to help out. We are using the social media hashtag #WeAreEssential to remind Congress that we are essential and we need to be treated that way. And we have a cool little tool that is, you can email your members of Congress, and that's the thing that's on the screen right now and that you can click through in the PowerPoint. We are asking Congress to do these 4 things. Fund a Medicaid grant program for HCBS providers to make sure that folks are getting the services they need. Ensure that there is enough protective equipment, personal protective equipment or PPE for direct support professionals and other disability service providers. Making sure that all caregivers, including siblings and cousins and grandparents, have access to paid leave if they need to stay home and help take care of their relative with a disability. And then economic impact payments for everyone with a disability, even if they're an adult dependent. I mentioned earlier that if you're over the age of 16, you won't get a dependent credit. We don't think that's right. So we are telling Congress they need to fix that problem. And if you click through to the link here, you'll actually get a bill number that you can cite. So some members of Congress are accepting phone calls. Some are really responding only to email. So if you want to call your member of Congress, I don't know how the Oregon delegation is doing that, but if you want to call your member of Congress, you can call them and the bill number will be in there and you can ask them to co-sponsor that piece of legislation. So I think that does it for me. So I am happy to answer any questions folks have, with the caution that a lot of this is still up in the air, and so I don't 100% always know kind of what the answer to the question will be, but I can do my best.
Bethany, we've got a few questions queued up for you here.
Great.
Here's a question from Dana. What if someone receiving Social Security marries someone who does not receive benefits or does not have an income from a job? So 0 income.
So if they have 0 income, you should be fine. Now, if they ever get an income, you may run into some problems. I think if you marry someone who's not on benefits, their income is kind of the big problem here. Now, if you're on SSDI, that shouldn't be a problem because SSDI functions differently. It's kind of the one place where we don't have marriage penalties. But if you're on DAC benefits or you're on SSI, you will probably run into problems, which is why we'd like to fix that. So fingers crossed. Maybe once
Thank you.
We're all back home from, or back at work from coronavirus.
Crystal asks, how do we report all the weird financial changes? For example, my husband was furloughed and now on unemployment, and I just got a part-time job and my son receives SSI. So a question about reporting changes in financial circumstance.
Unless your son, so it'll get complicated with in-kind support and but presumably not a lot has changed directly in terms of how much you and your husband are helping out your son. If that's changed, that's a conversation you should probably have with the Social Security Administration. But if your son is kind of continuing as usual, and while you have had a lot of financial changes, what the help that you're providing to him hasn't changed a lot. I wouldn't be overly worried about reporting it for what it's worth. Although if you're concerned, you could always reach out to SSA. I will say they're getting through their workloads on this kind of crisis, although while they're teleworking, because all the field offices are closed, they've actually been getting more work done, I guess, while teleworking. So they've reduced their backlog quite substantially. So you might be able to get an answer, but I would guess that unless what you're actually providing to your son has changed a lot, I wouldn't necessarily be too worried about that.
Jacqueline says, we're wondering if we get SSI, how is that affected by me applying for unemployment?
So it isn't until you're approved for unemployment. And as I said, unemployment rules are kind of complicated and they vary a lot by state. But if you're approved, you need to report the income to the Social Security Administration. And then, as I said, in likelihood, your benefits will go down from SSI. but you shouldn't see other changes. It should pretty much just be you're getting UI benefits and your SSI benefits are reduced.
Joanna asks, and this is a question about the economic impact payment or stimulus payment. Says it's unclear if you get SSI and don't file taxes, can you file for the stimulus? And the same question about getting SSDI.
So you should get your payment automatically, even if you don't file your taxes. Now, if you're claimed as a dependent on someone else's taxes, you may not be eligible for a payment. That's one of the reasons why you might not be getting a payment. But otherwise, you really should be able to get your payment automatically. As I said, the last I heard, and this changes a lot, was that the SSA and the IRS were going to do the data match, and they were going to share the information and make the payments this week. But I just want to caution that I don't know for sure if that's what's going to happen, because it's very complicated. If you have a bank account and they direct deposit the money, it should say from the IRS. If you suddenly have, $1,200 in your bank account, you can probably assume that's what it is, but it should say it's from the IRS.
Melinda says, I work for a provider as an employment manager. People we support at their community jobs are getting temporary raises due to working during the pandemic. How does this raise affect benefits?
This is a really complicated issue. And the problem is it probably does affect their benefits. It's like when you have a minimum wage increase, people may have to reduce their hours. It is, unfortunately, to waive the Social Security rules has to happen at the federal level. If in terms of state Medicaid rules, you should be able to advocate with your state to make sure that those wage increases won't impact Medicaid. But unfortunately, because Social Security is a national program, we have to authorize those waivers at the national level. And like with the asset limits and a temporary waiver of the asset limits, I've been advocating with Congress about this, but unfortunately not getting a lot of traction. If this is, I would strongly recommend reaching out to your members of Congress and flagging this and telling them that this is a problem, because I don't think anyone wants this to be a problem. Actually, Senator Romney from Utah introduced is going to introduce a bill, and I have gotten 3 emails already from folks who either work in grocery stores or are mothers of people who work in grocery stores asking how this will impact benefits. And so I am raising it with Senator Romney's office, and hopefully we could maybe see some action, but unfortunately it will take a fix at the federal level, which is a lot of work. Sorry, I don't have a better answer on that, but.
A couple of people are asking about receiving the stimulus payment, if they have not received it yet, or and who they should contact for questions about that. A similar question here for people who are still working and receiving SSI or SSDI. Do they have to file taxes in order to get the stimulus check if they have not seen it yet?
So they shouldn't. You should get the payment automatically. And as I said, they shouldn't have been issued yet. So if you haven't got them yet, I wouldn't worry about it for like another week or two. The other reason I wouldn't worry about it for a week or two is, unfortunately, the IRS doesn't have a functioning hotline right now. They are a little bit stressed out over everything that they're trying to implement right now, and they have a number, but when you call into the number, it doesn't pick up. So I would just encourage people to wait. And once I have a number I can give people, I'm going to send it out to everyone and ask that ARC chapters share it, because I'm sure people will have questions. And unfortunately, right now, that number just isn't working. And so I don't have a number to give you. If you're really worried about it, you can go onto the IRS website, and they have a Get My Payment form, and you can try and use that. but it has by and large not been working well for people with disabilities who are on SSI or SSDI. So I will just caution you that it hasn't been working for most people who receive those types of benefits. So it might not work. If you'd like, there is a non-filer form that you can fill out. It's the form I linked earlier in the presentation. Let me go here. The link that's on the screen right now, the non-filers enter payment info here. You can go there, and if you have a bank account, this won't work if you usually get your Social Security benefits on a Direct Express card. But if you have a bank account, you can enter all that information there and get your payment. You may get your payment more quickly. That has happened for a couple of people. I caution because like all of this changes pretty much every day. And so I don't always know, but the latest I have heard is that if you really need that check soon, you can try filling out, and you have a bank account, you can try filling out this form and it may come more quickly.
Thank you for that. Let's see if we can squeeze one final question in before we wrap up for the day. And this comes from Jacqueline saying, my son will turn 18 this summer. We can't get a hold of anyone to learn about the adult transition process. Do you have any advice on who to talk to get some advice about benefits and how they may change when you turn 18?
So I'm going to kick this one back to you, Alan. Who should they talk to?
Great. Hey, in Oregon, the first place we suggest if the person accesses developmental disability services through Oregon's Office of DD Services is to reach out to your county services coordinator. So we recommend you start with your county services coordinator. If you're not having any luck there, please reach out to us. We've got some other resources, so you can email us at info@thearcoregon.org, and we'd be happy to connect you with the resources that we have.
Well, thank you, everyone. It was wonderful to spend some time with you. And thank you for answering my somewhat silly questions, but it's always good to hear how everybody is doing. And may you have a great rest of the day. And if you celebrate Star Wars related things, a belated May the 4th be with you. So.
Thank you,
Bye.
Bethany, for the presentation today. And folks, that's going to bring us to the end of the broadcast. Now, when the webinar closes, a brief evaluation survey will appear on your screen. Please take a moment to share your feedback with us. Your comments help us improve future webinars like this one. During the webinar today, Bethany talked about asset limits and asset limit penalties. Now, if you or someone you support is concerned about asset limits affecting their public benefits, consider learning more about our Oregon Special Needs Trust program. Now, in addition to ABLE accounts, which were also mentioned during today's webinar, special needs trusts are another available tool that can allow a beneficiary to save money for the future while not jeopardizing their eligibility for public benefits. You can learn more about Oregon Special Needs Trust and even see a comparison between special needs trusts and ABLE accounts at our website. And finally, before you jump back into your day, we want to invite all of you to visit our newly redesigned website at thearcoregon.org. There you can join our new online community to access new resources on the way soon, including more recorded webinars like this one that we're getting ready for you. We also invite you to follow us on your favorite social media platform. We're active on Facebook, Twitter, and Instagram, and would love to connect with you there. So on behalf of all of us at the ARC Oregon, we want to thank you for joining us for today's webinar. Have a good day.